Hi, welcome. I'm trying to learn medicine, today inactive colon. And after we've done that, we're gonna do standing yoga, a bit standing yoga. And if you participate in the standing yoga, and we're gonna talk about eating, digestion, defecation, internal anatomy, disease, and stuff like that. I don't know what I have read. Now, the first thing, this is called inactive. And the other thing is ulcerative. Why is there no C in ulcerative? I spoke about it 20 parts ago. Why is it ulcerative, not ulceractive? Here's it inactive colon, whatever. Inactive colon doesn't sound good. What is it? A condition in which the large bowel is sluggish in its response to overfilling, is slow to pass on its contents, and fills with... Okay, I don't really want to... and fills with soft, putty-like feces. It is also known as sluggish bowel. So we're not going to talk just about defecation, but also about feces. Okay, I don't know what sluggish means. Okay, there's a problem with the bowel. That's somewhere in the tummy. I don't know exactly. And its response to overfilling, it is slow to pass on the contents, and it fills up. And the thing, the inactive colon is also known as sluggish bowel. That means something like lazy, sluggish. Okay. Symptoms: constipation, but with... We're going to talk a lot about these things. Constipation, but with soft and not hard faces present. We had not done constipation yet. We are by COL, colon, not constipation, COS. But there is a problem with the passing on of the internals of whatever. A problem with, I don't know what word it is, with defecation. A problem with defecation. No, and this is not, people with inactive colon have also constipation, but it is not that it is hard as a constipation because it cannot come. We have not done that, but because it is not passed out, but it is soft. Futile efforts to defecate are made. I don't know what futile means, but I think that means people are putting much effort into it. Watery diarrhea may occur because the bowel produces fluid in response to continual irritation. We have to do constipation before we can draw conclusions, but I think these two together are very interesting. Okay, whatever. The human body responds to it by releasing fluids, and that whole thing makes then watery diarrhea. Cramps due to wind may occur in the abdomen and rectum. What wind? Whatever, people can have cramps in the abdomen and rectum. Duration. The condition may be lifelong, and although harmless, may be annoying and difficult to cure. In what way is it harmless? Because nothing else happens except that the people have problems. But it's annoying and difficult to cure. Lifelong. Causes. Yes, I didn't say that this is no medical advice, so maybe you notice that this is no medical advice, we're just reading it here. It may persist in older people, so older people have it also. Causes. Confining old and infirm patients to bed and letting them get constipated. Using bedpans instead of lavatory or commode may inhibit normal defecation. These are the causes? I don't understand what the causes are. Confining old and infirm patients to bed and letting them get constipated. So it is the causes. So it can be that old people are infirmed to bed. I don't know what it all means. I don't know what the word infirm means. But I think that old people are lying a long time in the bed. And that when they get constipated. No, you don't know what constipation is. Whatever, that problem can cause it. And the other thing, using bedpans instead of a lavatory or commode may inhibit normal defecation. I don't get it. And how does it now cause inactive colon? Whatever. Very honest with it. Treatment in the home. Use a mild laxative, whatever, some type of medicine. Train the bowels to open up at regular times. For example, half an hour after breakfast, and use the lavatory or commode. Are we speaking about the position in which the person is defecating? Whatever. Try to we're advising it to regulate the time of defecation and also maybe the position. Eat plenty of roughages. For example, bread, fruit and vegetables. Whatever. Roughages are brand fruit and vegetables are. Regular exercise may be helpful. You should do sport, they say. Abdominal cramps can often be helped by lying face down on the bed. This allows the passage of wind. Well, what is wind? Okay, abdominal cramps can often be helped by lying face. We're saying that abdominal pains can be helped by lying face down. This allows the passage of wind. Whatever. What are you saying here? But again, this is not medical advice. Maybe it's also bad for some things. But I think it's interesting. When to consult the doctor? If symptoms do not respond to the simple treatment described above, consult the doctor. What the doctor may do: advise you about diet, exercise, and the use of suppositories or enemas when necessary. They're giving you tips how to live life. Arrange nursing care with enemas or removal of feces. I don't really know what we know. Whatever, more life advice, but I don't know what we're not talking about. Prevention, suitable diet and exercise. Outlook, the tendency is usually lifelong. If it's lifelong, but it can be prevented. Can it be caused once, then it is. But if it is lifelong of a tendency, oh, but that's interesting. Why do people have it? Now, what is the cause? Because the two things I don't understand what we're talking about, but I think it's just about way of living. But there must be some people who have a tendency to have it. I want to know what the biological tendency to it is. Whatever. All we can say here is some changes in the lifestyle, and that should prevent it. But the tendency to have it is still there. Whatever. That was the part 2 inactive colon. If you were here for medicine, inactive colon, you can go to the next part of medicine. We will do now standing yoga. If you stand participating in standing yoga, let's do it your arms. And your feet stand together and we're breathing in and everything out. Without the arms down. In the arms up. Out the arms down. In and out. Out open to the side. In and out. Out open to the side. In and out. And out open to the side. Make an inch space between your feet. In and out. Out and sink a bit down. In and out. Out open to the side. In and out. Out and down. In and out. And out, lean onto the knees. Breathe in. And out, make a hell with the back. In into the middle. And out around back. Belly with the back. In into the middle. And out a hell with the back. In into the middle. And out the belly with the back. In into the middle. And out, come with the long back up and make it double backwards. Shoulder joint. And now breathe again into the arms up. Out down to the side. In and out. Out the arms over the sides down into the chair. You can come halfway up. Come higher up. And out and we're coming up. We can reach high. Shoulder open to the side. In and up. Out the arms over the sides down. You can come halfway up. Higher up. And out and we're coming up. Breathe in, come up onto the toes. And out and sink down. And again in and out. And out and down. In and out. Out the arms on the sides down and bring the feet again together. Breathe in, bend the right knee. And breathe out and stretch your left leg. Breathe in and change. And out and stretch your right leg. In and change. And out and stretch your left leg. In and change. Out and stretch your right leg. In and to the middle. And out and down. No neck stretching. Breathe in with the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in the hand again in. And out and down. Breathe in with the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in the hand down. Out and down. Now the pelican. Make hand with space between the feet. Shift the weight to the heels and breathe in and out, down. And out and up. In and out. Out and up. In and out. And out and up. Now take hold on the elbows and gently from side to side. Hands again down, feet together. And breathe in, come halfway up with straight back, monkey half lift. And out and down. In and halfway up. Out and down. Breathe in, lift the arms up dialing swan. Bring the hands together and lower down, hands down. Now now have the toes pointing to the outside. Have an ulnar length space between the heels. Breathe in, lift the arms up. And breathe out and sink down into the garden pose. Place your elbows against the inside of the knees. Breathe in and straighten the back up. And breathe out and come with the back up. Breathe again. And out, back into the garden pose. Breathe in, straighten up. And out and come slowly one straight line up. The crown of the head first. The arms down. And breathe again in. And out and sink again down. Elbows against the inside of the knees. Breathe in, straighten up. And out and come with the back up. Breathe again in. Out, back into the garden pose. Breathe in, straighten up with the back. And out, tuck the pelvis in and come with the crown of the head first up. Hands. Now put the palms of the hands together and the elbows together. Breathe in and lift the arms up. And out and down. And again in and up. Out and down. Hands together, breathe in. And out, stretch in front, bring onto the head down. And back. And out, stretch in front. And back. Now have the feet standing together. Intertwine the fingers behind the back. Breathe in, twirl up, shoulders back. And out, turn the head over to one side. The chin down to the clavicle. Breathe again in. And out, pull the hands down to the ground. Breathe again in. Lift the gaze and turn the head over to the other side. Breathe again in. Out, chin down to the clavicle. And pull the hands down to the ground. Breathe in, lift the gaze. And bring the gaze back into the. Now, the feet again shoulder wide apart. Intertwine the fingers again behind the back. Bring them over to one side. The stretch of Venus. Breathe in, shoulders back, turn up. And out, head over to the side where the hands are. And chin down to the clavicle. Breathe again in. Out, pull the arm and lift the shoulder down. Breathe in, lift the gaze. Turn it over to the other side. Also the hands over to the other side. Hold up, shoulders back. Breathe in. Out, chin down to the clavicle. Pull the arm and lift the shoulder down. Breathe in, lift the gaze and turn it back. Feet are together. One arm behind the back, the other one up. And bring the head over to the side. Don't pull at the head. Breathe again in. And out, look up to the hand on top. And the hand again up. Other hand behind the back. Breathe in the other hand up. And out, bring the head over. Don't pull at the head. Breathe again in. And out, look to the fingers of the hand, which is taking the hand over. And the hand again. And now breathe in, lift the arms up. And breathe out, draw the shoulder blades together. Breathe in the arms up. And out and down. In and up. Hands together, breathe out and lean back. In to the middle. Out, leaning and back. In to the middle. Out, lean over to the side with further wind. In into the middle. And out over to the other side. In into the middle. Now across the arms, intertwine the fingers, reach high with screw. Without reach round all of the back. In and up. Intertwine the other very low, breathe and reach high. Without reaching front all of the back with drill. In and the hands up. Out and lean back with long arms with sky up. In and up. Then out, leaning it back. In and up. Out the hands down. Breathe the hands up. Bring the palms together. Allow the hands slowly down to heart center. Breathe out. That was the standing yoga. I thank you very much, and until next time.